At Houston Colon and Rectal Surgery, we want your surgery to be successful. That's why we have prepared this short video so that you can follow some simple steps and achieve the best possible results from your anal-rectal surgery. These instructions are for you if you are undergoing surgery on the rectum and anus, such as surgery for hemorrhoids, fistulas, fissures, warts, tumors, or prolapse. These include hemorrhoidectomy, ligation of hemorrhoids, anal fistulotomy, sphincterotomy, repair of sphincters, repair of rectocele, or removal of rectal warts or tumors. These simple steps will improve your outcome from surgery. So follow these directions and call our office if you have any questions. Even before surgery, you may want to start adding some fiber to your diet. Taking Metamucil once or twice a day is a very healthy habit. Avoid straining for bowel movements. Bearing down or pushing hard for bowel movement is often the root cause of many rectal problems, so this should be avoided at all costs. If you take any blood thinners and herbal supplements, stop them before surgery. Aspirin is okay to take. Do not eat or drink beverages after midnight. Take all of your usual medications with just one sip of water. The only medication you should not take are the diabetic medications. Wear loose and comfortable clothes to the hospital and bring a family member or friend with you. You may have an IV, some tubes, or nasal catheter. Don't be alarmed. These will be removed at the appropriate time. You will also be rather sleepy. There may be some nausea or soreness. Ask the nurse for remedy. Upon discharge from the hospital, you will need a responsible friend or family member to drive you home. On your way home, pick up the pain medication from your pharmacy. While you're at the pharmacy, also buy some Metamucil and Dulcolax tablets, which are over the counter. When you are home, stay active, but don't plan to leave your house. And don't plan to drive or go out for groceries. You can sit and walk as needed. 2 pain pills may be taken every 6 hours. It is a good idea to take these pills round the clock for the first few days after surgery, and not wait until the pain gets unbearable. These pills have a tendency to cause dizziness, drowsiness, and nausea. You can always add Motrin, Advil, or Toradol to the narcotic pain medications that you have been prescribed. While you are at home, stay busy and keep yourself occupied with the things you enjoy most. This is a great time to go back to your favorite hobbies, and this will ease your recovery from surgery. So watch a movie, read a book, or listen to your favorite music. These favorite activities will positively impact your recovery, so stay calm and positive. After surgery, the area around the anus will swell up as the stitches dissolve. There may be some bleeding and bruising as well. This is normal, unless excessive. As the stitches dissolve, the tissues around the anus will cause an inflammatory reaction. So don't be alarmed by some soreness, swelling, bleeding, discharge, or even false urges to defecate. Take a lukewarm bath for 10 to 15 minutes, 3 times a day. This will help relieve the pain and spasm at the surgical site. Water also helps keep your wounds clean. You will be provided a sitz bath bowl at the time of discharge, or you can buy one at your local pharmacy. After the bath, dab the surgical area dry and place a 4x4 gauze in contact with the wound. Keep the gauze in place using an underwear. There's no need for tape. The gauze will help absorb the moisture and help with the healing process. You can eat whatever you want, but in small portions. A common mistake is to go on liquid diet or drink large amounts of water. that may cause problems. So just be your normal self and eat a healthy diet. Taking Metamucil twice a day is a must for 4 to 6 weeks. If you judge the stools to be too loose or get more than 2 movements per day, cut back on the dose, or you can stop it completely. Some constipation is expected and almost normal after surgery. Do not be alarmed. Do not push or strain to have a bowel movement. You will break your stitches doing so. Make only normal efforts to pass a stool. Do not strain. Do not push, and do not bear down for defecation. You may feel false urges to defecate, but the sitz bath can be helpful if you have these sensations. Some constipation is expected after surgery, so don't worry if you had not had a bowel movement for a couple of days. You can take 2 Dulcolax tablets at bedtime the night you are home from surgery. If you have no bowel movement by the next day, you may use 2 to 4 tablets before bedtime until you do have one. Once you are having regular bowel movements, stop using Dulcolax. Prune juice also helps. Whatever you do not push down trying to have a bowel movement. Some pain, bleeding, nausea, difficulty in urination, constipation, or even diarrhea is normal. But if you are experiencing any of this in excess, then call your doctor. Problems with urination are quite frequent in men, and you may try urinating standing up or under a warm shower to ease this problem. Strenuous exercise, pushing, straining, or heavy lifting is to be avoided for at least 4 weeks. One can drive when comfortable around 2 weeks, but prolonged driving is to be avoided for 4 weeks. You will be seen in office 2 weeks after surgery. Remember, it takes 2 weeks before you start feeling better, and full recovery takes 4 to 6 weeks. So be patient. Avoid lifting, pushing, or straining until then.
We hope this video gives you a general idea about your surgery. However, if you have any questions, please do not hesitate to contact us at 281-583-1300. Also, further information can be obtained at our website www.colonsurgeonhouston.com.